It is heartbreaking that so many women do not fully understand breast cancer, even after being diagnosed. And honestly, it is tough to try to make sense of all the medical terms. But I'm here to help you today in understanding what breast cancer is and what you can do next. Breast cancer, two words that can change a life. But what exactly is breast cancer, and why does early detection matter, especially for Nigerian women? Before we start, I want you to take a deep breath and not panic, because cancer can be managed and even beaten. Breast cancer is one of the most common cancers affecting women worldwide. And in Nigeria, it accounts for over 22% of all new cancer cases. Breast cancer begins when cells in the breast start to grow abnormally or uncontrollably. These cells can form a lump or a tumor, which may be felt as a swelling in the breast or detected through medical imaging like a mammogram. Now, unlike normal cells that grow and divide in a controlled way, these cancer cells multiply rapidly and can invade nearby tissues, lymph nodes, and other distant parts of the bodies like the lungs, the liver, bones, or brain. This is what we refer to as metastasis, which can sometimes make the disease more difficult to treat. There are different types of these abnormal cells, each with their own characteristics. Some are more easily treatable than others. Unfortunately, in Nigeria, over 70% of breast cancer cases are diagnosed at late stages, reducing the chances of survival. But the good news is that if it is found early, your chances of survival are very high. With advancements in treatments like surgery, chemotherapy, radiation therapy, targeted therapies, and immunotherapy, many women diagnosed with breast cancer can live long and fulfilling lives. How did I get breast cancer? This is a question many women ask after their diagnosis. Please do not blame yourself. The truth is, breast cancer does not have a single cause. Although some cases may be influenced by certain things like age, family history, hormones, lifestyle, and environmental factors, many have no known clear cause, which means that breast cancer is not really your fault. Many people believe that breast cancer is always inherited, but the reality is that 70% of breast cancer cases are sporadic, meaning that they happen randomly, without a known family history or a genetic mutation. Certain things known as risk factors can increase the chances of developing breast cancer. These risk factors can be grouped into modifiable and non-modifiable factors. The non-modifiable risk factors include things like your gender. Being a woman is the biggest risk factor. Age. The risk of breast cancer increases with age, especially after the age of 40. Genetics and family history. Having a close relative like a mother, sister, or daughter with breast cancer increases your risk. Mutations in genes like BRCA1 and BRCA2 can also raise your risk. Having a personal history of breast cancer. If you've had breast cancer before, there's a higher chance of you developing it again. Early menstruation and late menopause. Starting your period before the age of 12 or reaching menopause after 55 increases the lifetime exposure to estrogen, which increases your risk of breast cancer. Dense breast tissue. Women with dense breasts have more glandular and connective tissue, which can increase the risk and make detection harder. Previous radiation exposure. If you've had radiation therapy to the chest at a young age, you are at a higher risk of developing breast cancer. Modifiable risk factors. These are things that can be changed. Number 1, obesity and excessive weight gain. Physical inactivity, especially a sedentary lifestyle, contributes to weight gain and a lot of hormonal imbalances. Number 3, alcohol consumption. Drinking alcohol regularly increases your breast cancer risk. Number 4, smoking. Smoking has been linked to an increased risk of breast cancer, especially in younger women. Women who are on hormone replacement therapies. Long-term use of estrogen and progesterone therapies for menopause can increase your risk. Reproductive factors such as having your first pregnancy after the age of 30 or never having children slightly increases your risk. Not breastfeeding may also contribute to a higher risk. Poor diet such as overconsumption of processed foods, unhealthy fats, low fruits and vegetables may also contribute to your risk. Exposure to environmental toxins and chemicals like plastics, pesticides, cosmetics, and certain endocrine disruptors may also increase your risk. Breast cancer comes in stages from 0 to 4, and these stages depend on the tumor size, the lymph node involvement, and how much the cancer has spread. In early stages, from stage 0, also known as carcinoma in situ, here the cancer cells are non-invasive and they are confined to the milk ducts or the lobules. You might notice things like lumps, unusual changes in the sizes of your breasts or in the shape, nipple discharge, or your skin starting to look like an orange peel. At this stage, it has not spread and it can be easily treated. There's also a high possibility of a cure with excellent prognosis following your treatment. You should start your treatment early with the right cancer specialist because as the stages get higher, the treatment gets more complicated. The next stage is stage 1, also known as early stage invasive cancer. Here, the tumor size is less than 2 centimeters and may or may not have spread to a small number of lymph nodes. This stage is also very treatable with surgery, radiation, and sometimes systemic therapies like chemotherapy, targeted therapies. The third stage is stage 2, or locally advanced cancer. At this stage, the tumor has grown to more than 2 centimeters, but is still less than 5 centimeters in size. The cancer may also spread to nearby lymph nodes. This stage is still highly treatable with a combination of surgery, chemotherapy, and radiation. The fourth stage is stage 3, also known as advanced locally invasive breast cancer. As the name implies, the tumor here is large, but the size is above 5 centimeters. There is also extensive lymph node involvement, and the cancer cells may have spread to the skin or chest wall, but not to distant organs. Aggressive treatment is needed at this stage, which often involves chemotherapy first, which is a neoadjuvant therapy, then surgery, then radiation, and any other type of targeted therapy. This is the stage where most women with breast cancer in Nigeria typically present. The fifth or last stage is stage 4, known as the metastatic breast cancer. At this point, the cancer has spread beyond the breast and has spread to distant organs like the lungs, liver, bones, or brain. This stage is considered incurable, but it can be managed with palliative treatment to slow the progression of the cancer and improve quality of life. Palliative care focuses on relieving symptoms, reducing pain, providing emotional support, and psychological support to help the patients live as comfortable as possible. Early detection does save life, and the earlier breast cancer is caught, the better the chances of a successful treatment. Just to recap, stages 0 to 2 have a higher survival rate with early treatment. Stages 3 is aggressive but still treatable, and stage 4 focuses on long-term disease control and overall quality of life. Now let's talk about treatment options. The best breast cancer treatment option for you depends on the stage, type, hormone receptor status, and your overall health. The main treatment options include surgery. Surgery involves the removal of cancerous tissue from the breast. It can be done to remove only the tumor and a small margin of surrounding tissue, like with breast conserving surgeries such as lumpectomy, or even the entire breast or both breasts in the case of mastectomy. In some cases, nearby lymph nodes are also removed to check if cancer has spread. This is known as lymph node dissection. Surgery is often combined with other treatments like chemotherapy, radiotherapy, and hormone therapy to improve treatment outcomes and reduce the risk of reoccurrence. Number 2 is chemotherapy. Now, chemotherapy involves using powerful drugs to kill or stop the growth of cancer cells. Chemotherapy can be given in the form of pills or IV infusion. It can be used before surgery to shrink tumors or after surgery to prevent reoccurrence. Number 3 is radiotherapy. Radiotherapy uses high-energy X-rays to target and destroy cancer cells. It is often used after surgery to make sure that all the cancer cells are gone. The next is hormone therapy, and this is used for ER and PR positive breast cancer. These medications block estrogen and progesterone, which fuels hormone positive cancers. Common drugs like tamoxifen and aromatase inhibitors are used. The next treatment modality is targeted therapy, and this is used for our HER2 positive breast cancer. As the name implies, these are special drugs that target HER2 proteins, which fuel aggressive tumor growth. Some examples of these drugs include trastuzumab, which is our Herceptin. The next treatment modality is immunotherapy. Immunotherapy helps your immune system fight cancer. This is for when other treatments do not work as well, and it's usually used for some triple negative cases. The next treatment modality is palliative care, used in end-stage or metastatic breast cancer. This focuses on managing symptoms, pain relief, counseling, nutritional support, and improving overall quality of life to control the disease progression. To figure out the best treatment for you, your doctors will need to do some tests. Some of the tests they would do would include things like a biopsy. Now, a biopsy is where a small sample of the breast tumor is taken and tested to check if it is cancerous or not. The next test is an imaging test, and a breast imaging test can either be a breast ultrasound or a mammogram, and this helps us to see how far the cancer has spread. The last testing we do is an immunohistochemistry, where we get a closer look at the cancer cells to determine the type of cancer we are dealing with. As previously said, we can manage and even beat breast cancer. It is a tough journey, but there is hope, especially when you understand what is happening and have a solid support system. And that's exactly what the BRAMS program is here for. You are in good hands.